Howell is on her way. Gingell is absent with notice. Gershenson.
Here.
Jackson.
Here.
McGilvray is absent with notice. Nelson.
Here.
Cavell. He's on his way. Joliet.
Here.
Lubes.
Here. Thank you.
We have a quorum.
We have a quorum. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approving the minutes. Our last committee was November 29th, 2022. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? All right, the minutes are approved. The next item is approval of the agenda. I have a motion by Commissioner Nelson, support by Commissioner Joliet. All in favor say aye.
Aye.
Opposed? All right, our agenda is approved. We arrive at our first public comment. This is public comment for items on the agenda. Is there anyone from the public wishing to comment? All right, our first public comment is closed. We move on to our first presentation from the Michigan Department of Health and Human Services. So I would invite you to come to the front of the table for our presentation.
Yeah, it should be sitting right there.
Yes, thank you, thank you.
For your presentation. And it clicks that way.
Oh,
Is it up?
Who's that?
Yes.
I did not know it was.
Clicker.
Maybe the technical difficulties today.
This is our presentation from the Michigan Department of Health and Human Services. So as we begin, you can introduce yourselves, and we'll just move forward. So we're happy to have any and all information.
Great, thank you very much. Our presentation is only 2 hours, so no. Because there's a lot to share and a lot to know. But my name is Dr. Renee Dudley, and I am the chair of the Oakland County, Michigan Department of Health and Human Services Board. And I'll have each of my colleagues introduce themselves, and we have also our directors that are here, and they can introduce themselves as well.
Good morning and Happy New Year. I'm Attorney Cherie Ross, and I am your appointee along with Dr. Renee Dudley to this Michigan Department of Health and Human Services Oakland County Board.
Good morning. I'm Sharon Campbell Starks, and I am appointed by the state to the board.
And as you can see, there are 2 county commissioners, or two of us that are appointed by the county commissioners and 1 by the state.
Good morning, I'm Tom Shire. I'm the Child Welfare Director for the Michigan Department of Health and Human Services in Oakland County. Nice to be here.
Thank you.
Good morning, everybody. I'm Belinda Arbogast. I'm the Oakland County Director over Cash Assistance.
So what we wanted to do is to share with you what this board does, what the MDHHS board does, and so, and to let you know some challenges that are upcoming that we all need to be aware of, because you may get a few calls. Oakland County is one of 5 counties in the state that's called what we call bifurcated, meaning we have 2 directors, one over cash assistance and one over child welfare. The county board, our board, is a 3-member board, 2 appointed by the commissioners and 1 appointed by the state. And our responsibility is to review qualifications and interview the applicants. We interview both applicants for the position of director of the department, but we also have other responsibilities to look at services and contracts that may impact Oakland County constituents. Economic stability is one of the areas that we'll be talking about. It includes cash assistance, medical assistance, food assistance, child development and care, state emergency relief, and state disability assistance. These are all the things that the department does for across the state, but also we're going to tell you how it specifically impacts Oakland County. Our Children's Services Agency, that's our director, Tom. Belinda's over cash assistance. is the Children's Protective Services, Family Preservation and Prevention Services, as well as foster care and foster home licensing, adoption, and juvenile justice. We are also have some oversight of aging and adult services. Unfortunately, we're also looking at adult protective services, independent living, adult foster care, and homes for the aged. So all of these are resources and opportunities that come into the county. The duties of the county MDHHS Board of Directors, we are one of the only board that is legislated by law. Act 280 of 1939. And we are agents of the county as well as the state and the Oakland County constituents. We coordinate delivery of services between MDHHS and the public-private agencies. There are contracts with public-private agencies on foster care and other sources and services, and so there's some oversight. We get information back from our directors as to what's going on there. We represent the County Board of Commissioners in negotiation with the county and MDHHS. We advocate on behalf of the Oakland County constituents. We get personal phone calls, we get letters, we also get visits to our home because all of our information is posted on the state's website. The duties of the Oakland County MDHH Board, we review and vote on contracts. Now, we may not always have the power to say no to a contract that's coming into Oakland County, but we have been very, I don't know if I want to use the word aggressive, of saying, one, what's the outcome? If we're going to approve a contract, what are some of the outcomes? What are some of the evaluations? What are the things that we need to see that this contract is effectively impacting our constituents? And typically what happens, we will either approve a contract because we see all of that information in it, or we will send it back without our signatures saying these are things that we need to have in order for us to effectively and conscientiously approve a contract. We ask for information, and typically what we do get that information back. They do call us, they do provide us with the data and the information that we need for us to be saying, yes, this is a contract that we want to see. We oversee the county child care fund. The child care fund covers the cost of kids that are placed into care, whether it's in foster care or residential care, and the county pays half of those eligible youth that are placed into care, and the state pays the other half. Over the years, we've had our challenges, but right now the state pays up front, and then the county gets reimbursed. The county reimburses that state allocation. In Oakland County, from MDHHS, just Oakland County alone, we receive $2,137,916,618 that comes into this county from MDHHS. That's why it's a critical amount of money that comes in to help everything that we've talked about. And this breakdown shows you how much goes to Medicaid, how many constituents in our county are on Medicaid, how many are on cash assistance, food assistance, child daycare, state emergency relief, state disability assistance. And as of now, this is our data as recent as 2021. Obviously, 2022 hasn't been compiled yet, but as of 2021, we were receiving $2 billion plus into this county. So we have, if you look at all of the residents, it's about 1,259 residents in Oakland County. That's about almost $1,700 per resident. But you can also see that it's broken down by the number of constituents that are receiving those services within Oakland County. Our state emergency relief fund, you can see over the years, 2022, it went down a bit. The goal of the SER is to provide, to keep families and children especially from harm, to obtain safe and decent homes in an emergency. So these are emergency cash assistance that goes to them. The other challenge that we have are kids that are living in poverty. Since 2017, we're seeing that number decline. But one of the things I want to draw your attention to in fiscal year 2020, it dropped significantly. And the challenge is it may have dropped because of the COVID dollars that were coming from the federal government, where we then began to see many of our kids no longer were in that category of qualifying for living in poverty. We don't know whether or not after the COVID dollars leave, whether or not that number would increase. And those are some of the things that we're also beginning to look at. As I shared with you, Tom oversees the child care fund. It covers the cost. and it's budgeted. He comes before this committee to present the recommendations for the child care funds, the amount of that allocation, and he monitors that very closely, and we also see that every month at our meetings. Child Protective Services, what this is are the number of intakes in the light blue, the investigations in the dark, and those that are referred, meaning those that have been picked up. We may have a lot of intakes, folks calling in to report, and then they are screened and they're investigated, and then it's determined that the ones that then go on for Child Protective Services. One of the things that we're really excited about is that the state and the department is looking at ways to keep kids in their home, not move kids out of their home, looking at preventive services, looking at other ways in which we can embrace families so that children are not going through the trauma of moving into foster care, if at all. And so that means that what we're looking at are those kids that are not going to be in that pipeline for continued abuse and neglect. Our foster care services and in Wayne County in 2022, we had 438 kids in foster care. Obviously, it's going down, and hopefully it will continue to go down because of the protective services issues and other challenges that we see in the county. We also have the responsibility for adoptions, and the adoptions that have taken place, we had 35 adoptions, 35 adoptions in Oakland County in 2022. The Adult Protective Services, the same kind of information that we get, the dollars that we're talking about, they're coming into the county. We have those that have been referred for protective services, for financial fraud, for abuse and neglect of elders, for a variety of reasons why our elders are under, that may come to our attention under protective services. And so in 2021, we had over 4,000 referred and 1,000 were assigned, to be monitored and for assistance. What we also want to share with you, the things that your phones may be ringing off the hook for. There are upcoming challenges because of the COVID dollars from the federal government are no longer going to come into our county. They're going to hit us in two ways. One, the emergency food allocation. Unfortunately, February is the last day that they will get the full amount of those dollars allocated. Now, understand that everyone who is on food assistance had a certain allocation based on number of kids in the family, based on other kinds of requirements. With the federal dollars that came into every county that came into the state, they received additional dollars. So for example, a family of 4 may have received $400 a month in food assistance. With the COVID-19 dollars that came in, they now moved up to $900. February will be the last month that they will receive that $900. Effective January, February, March, effective in March, they will go back to that $400. In the face of rising food costs, you're going to get calls. We're going to do everything, the department is doing everything they can to alert the county, to alert the constituents, to make sure, and what that we ask you to do is to make sure that they are aware that this is going to occur. This is the last month that they get that full allocation, and it is not that Oakland County is taking it away or Michigan is taking it away. It is the federal dollars, the COVID dollars that came into the state will no longer be there. Redeterminations for Medicaid. During COVID, anybody that said they needed that help, they got it. They did not have to go through a certification, or they weren't redetermined, right? We did not continue to do redeterminations. So effective January, February, March will be the last day that they will just be grandfathered in. Starting in April, we'll start that redetermination to determine whether they're still eligible for Medicaid services, which means then that there will be, we're talking thousands of calls, 700,000.
700,000
Some families, which translates to 1.2 million people. But they have to go through the redetermination. So if they call you, they've got to make sure they call and update all of their information that's in the system. They're no longer going to be direct calls to offices. They're going to be funneled to a, what is it? Yes, they're going to be funneled through one system so that they could get help as needed. But the important thing is that if they call, or if you have constituents that you are presenting in front of, or if you have your coffee clutches, et cetera, please tell them to update their information as soon as possible in the portal for DHHS,
So all the information can
Bridges.
be updated online.
online, yes.
If they don't have access to online services, are they able to make an appointment in the office?
Belinda, if they don't
They have
have access, we have kiosks that
Yeah, there
are
are kiosks in
located.
each of our local offices.
Right, so they can come to the office and to update their information there and possibly get help if they need it. But it's gonna be critical, that's the big piece. The news is gonna hit, and we are just wanting, and we're glad that we're able to come to you before all of this comes into place, so you are aware of what's going on. We meet with the directors of both of those departments, the state directors of both of those departments, and Cherie will share with you how we do that. And they both have been telling us this is what's going on and this is what's going to happen. So those are the challenges that we're seeing. And that's just a real quick overview of MDHHS and our local office. But one of the other pieces that you also support is what's called Michigan County Social Services Association, which is also mandated by law. And I'll have Cherie sort of take you through what that is.
Yes. The Michigan, we call it MCSSA, and that's the abbreviation for Michigan County Social Services Association. And as Dr. Dudley indicated, it was formulated in legislation, Public Act 280, which requires that we have these local boards, and also that these local boards meet on a statewide basis. And so MCSSA represents the county boards of the Michigan Department of Health and Human Services. And what's significant about this is that each local county has a 3-member board, and their members are supposed to be doing exactly what we are doing, oversighting and all the things that Dr. Dudley has already talked about. It's not mandated that we participate with MCSSA, but I'm going to tell you that it's really important that we do. And it's also important, and we'll share later, that our county commissioners are familiar with the MCSSA. One of the things that's exciting about it is we are legally required to advise the state director about the needs of the citizens being served through the Department of Program and Resources, and we are really good in the Oakland County regime here in terms of hearing what our directors have and what their needs are, in addition to listening to constituents that come to us via letters or phone calls, and to make sure that our county directors are addressing their needs. And we have also had some commissioners who have contacted us, and we were able to get some of their issues solved based on the constituents. We act as an advisory to management of local county operations, and oversees and provides input and suggestions for effective county operations. And that has been working very well for us as a team approach. We have worked very good together. We're involved in committees, we attend annual conferences, and one of the things that, I'm sure you can read that, but what I find very significant is that as a local county, we have the opportunity to speak with the other local county boards and to find out what's working in their counties and what's not working in their county. And what we found, you all have heard, sometimes the squeaky wheel gets the oil, so to speak. And by us being very aggressive and as advocates, and as advocates for our local county constituents, we're making sure that by us being at the table, we're speaking at a direct level with those who make the decisions with respect to the State Department of Health and Human Services, and with our legislators. And so we have found it very significant to be able to meet with our state reps, our senators, and to let them know what the needs of our constituents in Oakland County are, and we're able to advocate for those needs very strongly. So you know that we will be very involved in this 700 families, 1.2 million individuals, particularly the Oakland County constituents, making sure that our residents know to go in and to update their information in the system so that they cannot be cut off, so to speak, from the food assistance program, and also from Medicaid. One of the things that we are asking, as we met with Demetrius Stalling, who's our state representative on the child welfare side, we meet with Dwayne Haygood, who used to be Wayne County, who's now been elevated up in a higher position. We are very concerned that when the Medicaid drops off, effective March, my concern, or our concern, is for those individuals who receive Medicaid services, like let's say that they're in the process where their doctors have referred them to specialists, and they have, and they're in that working where they're now seeing people. If that automatically cuts off, then what happens to those services? What happens to those follow-ups? And those are some questions that we are posing, and we're hoping that we'll be able to get some answers, that people don't just get cut off in midstream of receiving those services.
They're not necessarily going to get cut off from Medicaid. They have to be redetermined
Right.
to make sure that they're eligible for those services. During COVID, redetermination was halted. All right, so the challenge is going to be making sure that their information is updated in the system so it makes it easier and quicker for them, that redetermination to take place.
Right.
So are recipients of Medicaid at this time advised that you need to
Right. Because
renew
we
your
meet,
information?
because we meet with the directors directly at the state directors, they shared this information with us. We came back, we shared it with as many people as we could, and our Belinda and others. State DHHS now is looking for a way to effectively let the community know. They have not, I don't know if they've started that advertising correct yet or not. So you are getting firsthand information as to what is coming down the pike. So they are working on a communications campaign to make sure that recipients know.
Okay. I think the other part that I think that needs to be clear is during that pandemic, some of the people, policies and procedures were laxed a little bit, so people who would not have been ordinarily eligible for the food assistance or eligible for the Medicaid became eligible. So not everyone in this whole redetermination are going to be, they may or may not be eligible. And that's the key, eligibility, whether or not they're eligible. Is that correct, Belinda? That's it.
Yeah, I just wanted to add that it's not like come April 1.
Can you come to the table to speak
Yes.
to the microphone?
Sorry. It's, effective April 1, we'll start the redetermination process, we'll start reviewing those cases. It's gonna take a year to get through all those. So it's not like everyone's gonna be cut off
Right.
effective April
Right.
1. Again, we have to look at their income and their assets and determine whether they're eligible. It will affect those that were able to stay on during these last 2.5 years. So just wanted to add that.
Thank you. Similar to what we experienced with the unemployment
Correct.
process.
Correct.
Fortunately for us, we were able to refer those out to our state reps. Commissioner Gershenson?
Would you prefer we hold questions till the end, or are you okay with having them right now?
I'm okay with right now.
So I'm wondering if it's appropriate for our staff to join in on the communications piece so that we could do press releases, alerting people in our community as well. And I noticed the adoption number has gone down is that a good thing, or it is
Tom,
not a good thing?
Just to answer your first question, as soon as we get the communications from the state, we can pass it to you.
Good.
We can pass it to
Our communications
Yeah,
team.
because we've got a great
here.
communications team too.
Right, because one of the things, this is an alert, this is an FYI, it is not the official, so we want to make sure that once the official communications come from the state, we can pass it on.
Okay, good.
Staff don't even know yet, just so you know.
Okay.
I'm sorry. So you can connect with staff to pass that on, because it would be our communications team and our health department that
Great,
would
right,
need
but
that
at this point in
information.
time, we have not received the official communication that the state wants to go out. And that's what we would prefer, we want to wait. We're giving you an FYI. That's
Sure.
all this is. This is
Sure.
Grenade Dudley and Cherie Ross and Sharon Campbell, FYI.
Thank
I'm
you.
just saying.
Thank you. I have Under your purview, you have Aging and Adult Services Agency. So at this table, you have 3 social workers here talking to you, so we each have an area of expertise. But I'm not aware of homes for the aged. Where are the homes?
Out there.
There are adult foster homes.
Oh, okay, all right, thank you.
Tom, can you answer Commissioner's question?
In regards to the adoptions, well, one, on the positive note, because of a reduction of kids in foster care, obviously there's gonna be less kids who are permanent wards who need to be adopted, which will bring that number down. But because of COVID and some of the hearing-related issues as far as court and delay in hearings, and that's impacted it as well somewhat, so.
Thank you. Commissioner Nelson?
Thank you, Madam Chair.
Commissioner Bell?
Question of just clarification. As a behavioral health provider myself, working with both private insurance and Medicaid recipients, are Medicaid recipients who receive behavioral health services, specifically children and teenagers who have disabilities, are they going to be affected by this redetermination for Medicaid?
So, that would be tough to answer. It depends on if the family's still eligible. It depends if they're getting Social Security or not. If they're getting Social Security, obviously they're automatically eligible for the Medicaid, so it wouldn't, the one with disability, it would not stop. But if the family is no longer eligible for Medicaid, then that, there's different income limits for the parent than there are for kids, so it really depends on the income.
So when we specifically think about some of those lifelong disabilities, autism, for example, you know, when we think about that redetermination of the need of services, and given that autism has lifelong implications, for me, I would view it as, well, this redetermination hopefully wouldn't impact or affect the services that they're receiving, given it's not necessarily gonna be a check mark off of, oh, no longer requires or needs, knowing that there's lifelong implications to not just autism, but other disabilities.
And the redetermination is per client, you know, it's per family. It's not, okay, let's check this box because they didn't make it, but each determination is individual. That's why we have a year to do it. And that may not be enough time, but we have to do it, the federal government has said we have to do it within the year.
And just to complete what the little presentation here, that's an excellent question, and to know that there are social workers here. We have the Add Your Voice. You know, you're very welcome to come to our meetings. The date and time is listed there. We meet at 1:30 p.m. and we usually have to post the agenda 5 days prior. But more importantly, attend the legislative conference. This is the opportunity. We go out and we meet with our legislators. Like I said before, we meet with the state representatives, we meet with the senators. And we have, our task as Oakland County board members is to make sure that we're representing our constituents. They're your constituents. And so you may have a position, you may have something that we may not know about that you feel should come to the table and should be brought to life. And I'll tell you, it's a really, especially now that we see that there's a lot of new legislators, there's a lot of newcomers, and so we want to make sure that we don't allow our constituents to fall through the cracks, so to speak. And so we try to make sure that we're there at the table having those conversations. We get excellent information from our 2 county directors, so that we are able to, we know exactly what we're advocating for and what to ask for when we go. And so your voices at the table are just as important. It's welcomed. And we'd like to see some of you, if not all, you know, come to our meetings, come to the legislative conferences, come to the annual conference. There's a lot of information that I think that, a wealth of information that we get on a county and statewide basis that I think that would be very invaluable to all of you.
And we had a couple other questions.
Yeah, I have one.
Sure.
So when the Oakland County Commissioners have a concern or something going on with a constituent, are we to contact our Oakland County DHS board members, or who is that person that we can contact? Reason I'm asking is just so that you all know, I govern Pontiac, me and Commissioner Nelson. But for the most part, it has been very, very frustrating for me to navigate DHS. And the only reason why I know this because I worked for State Rep Tim Gramo also. And I wanted us to somehow, or our board can find out, who do we call? Because I know you kind of in between, but we need to know who is that direct person we can troubleshoot constituent matters, be it if we got to do constituent service work. Because navigating DHS is very, very interesting, and I'm going to leave it at that.
Like many,
And you know, when I worked for the state rep, we had direct
and you
people.
have it here. That's why we're here.
Okay, so-
You've contacted me in the past, and we have made sure that we passed it on. The two
Well,
people.
let me say this. You do your part, but I'm going to be honest with y'all. I ain't heard back from nobody. So that's where I'm like, you know what? And I just do it my way when I used to work from the state.
All right,
And I
right
will
now-
go my way because at the end of the day, y'all only can do so much. And I know from my experiences dealing with, they can be very difficult. So thank you all for at least passing it along. But I think the last time we had the situation, I just was like, forget it. I'm going to go on and do what I know, how to navigate and get through. Because that way that I thought was the setup, that's why I brought that up today, because I thought that's who we call is you all to help us troubleshoot that. That didn't come back that way.
I think that a couple things. One is when we get the information directly from the constituent and also information from you, we take that very seriously, and we have conversations with both of our directors, and we hold them accountable. So we don't let them just tell us it's solved. They come back and they give us a complete report as to how that issue's been resolved. Now, the second component to that is because these people's individual information and their individual lives is private. And so we don't have, there's so much information that we have that they cannot provide to us.
Yep.
Because of the privacy. And so we respect that, so we can basically peel it down to whatever the issue was. It was resolved, and most times we will hear back from them that it was resolved, and we haven't gotten any follow-up letters from the constituents. But I think that given the protocols and how things work, if your people that you're working with have an issue, I think the appropriate place would be to start with Belinda Arbogast if it's food assistance, cash assistance, Tom Shire if it's anything doing with foster care, protective services, and
What
that
if
kind
it's
of
as
things.
simple as them getting in contact with their worker?
Call them. If they've
Okay.
come to your attention,
Okay.
that's why we ask that they be here.
Because I knew at one point they was changing the way the system was working with
It
DHS
still
and how
always
they.
changes.
Okay, got it.
My bridges and something else that drove us
Got
to
it,
drink.
okay. But that's fine. So if our
I'm sorry,
team.
did I say that out loud?
So if our
have
team
your
could,
cards, we have your contact
if you
information.
all just could share, or if you could share your contact information with our staff, so they can just share that information with all commissioners,
Right, and
that'd
what
be
we'll
great.
do is email it back, their contact information. Those will be the most direct impact. We have found that they have been extremely responsive because we ask. If a constituent calls, writes, or drop by our house, we make sure that that is on our agenda and that there's a follow-up, and you can see our minutes that they do follow up.
Right.
And so then please, one, if you have a constituent, we need to know who they are. We need to know their names, if you have any other information, so that they can immediately follow up, and they will follow up primarily with that constituent. And then probably that you know it's been addressed. The details of it, you may not get.
Right, we not gonna
because
get
of-
it.
Right.
They don't share it, and I'm gonna let commissioners know now, they do not share a lot of information, but again, like they said, and that's only because I've been working with them even when I was at, under Tim Gramo as a state rep. And just to let y'all know, we are not privy to a lot of information, but as long as we know that it's getting handled, that's our main concern.
And we
So.
follow your directions on your cell phone. You say, leave a message, and
Yeah.
I did. All right.
No. We connected. It's just that circle back, and I was just like, forget it, because I already know, And I was just trying to get them in touch with their caseworker, which we eventually got it. So that's why y'all didn't hear back from me, because it got resolved.
But
So,
we know Tom took care of that.
Yep, thank you.
Yes.
Commissioner Cavell, followed by Commissioner Jackson.
Thanks. I'm one of the other social workers.
Hi, son.
So, from my
We
understanding,
have open positions, by the way. No.
from my understanding, these funds aren't that flexible. right, you don't have a lot of local leeway to do something with them. It's just kind of pass through handout. Okay. Darn, I was hoping you'd say something changed. That'd be cool.
Well, we did have a change. Our director, Belinda, we had a hard time spending our emergency services money. Direct support assistance money. And she was very clever. And we can let her share that with you. She's actually helping our constituents with using those funds. And I thought we were really ecstatic to learn that.
So in Oakland County, I've worked in many counties, but in Oakland, since I've been here in 2003, we've never really spent our direct supportive services money, which is allocated by the state, a certain amount for the fiscal year. And it's for families that are working that need vehicle help with getting to work, vehicles, buying a vehicle, repairing a vehicle. It's $5,000 right now to purchase a vehicle. It's one time only. It's $900 a year for car repair. They can do that every year. We pay one-time car insurance, so if you buy a car, we'll pay your insurance, so you have it up front. It's to buy clothing, whatever they need to try and keep them employed. So I come up with a new system. I did it when I was a district manager, and it worked well. And we were allocated about $101,000, and we'll be out of money by the end of this month.
Oh, good, thank you.
Because before we couldn't spend it. What? We had to send the money, they were giving it to
Send
other
the money
counties.
back, or I've
so.
given it to, so I'll be asking my boss to reach out to get more money for this funding, because they're coming in like wildfires. I dedicated 2 workers, 2 of my analysts. They're handling all the referrals for the county, and they said, Belinda, we're gonna be out of money. Now we have 16, we have 39,000 left with 16 referrals in at $5,000. It's gonna be gone. It's gonna be gone by the end of this month, which is really a good thing on one hand, because maybe next year they'll give us more money, because they've been decreasing. If you don't spend it, you lose it.
Right.
So I look to ask for more money.
I work with the population who has Medicaid. Years ago, I would refer to that, because I'm aware of the car payment, repair, purchase. And most of the people were denied, so I'm glad to hear that it's
They were
changed.
not, it's a matter of when workers have 1,000 cases, they didn't have a chance to get to the direct supportive services. There's no standard of promptness on it, like a due date. It sort of gets pushed aside, or they don't do the work, or, whatever the issue was. A lot of people denied if they don't have a valid driver's license, or some things they have to. But we are approving them, and they're doing them correctly, and workers are loving it, because it takes that off their plate. They just email my staff, and my staff handle it.
And we also have the furniture bank. We, as a company, we make sure that we have the furniture bank monies there available for our Oakland County constituents who need furniture can go and get that as well, so.
Thank you.
So then, do you all collaborate with other agencies a lot? I mean, Chair Loops mentioned this about like seniors and that sort of thing, right? Like a lot of the housing organizations would benefit from services like that, or workforce development. Is there some sort of way to make sure there's referrals or overlap, or, help me
We
learn?
work with Michigan Works. I'm actually on the board with Michigan Works, so we work directly with them. They have less money to deal with. Generally, we send them to them, but if they're already employed, they don't need to go to Work First. So if they're working with Work First, obviously that's the first spot, and then us. But they don't get as much money as we have. In the past, we've given them money out of our pot of money, out of Oakland's. We won't be doing that, obviously, since there's gonna be none left to spend. We do whatever we can. I have a community resource person that actually sends out emails all the time about all the organizations that can help, even with seniors. Today, we actually met with, oh my gosh, it's gonna leave me blank, one of the agencies that are now trying to help single adults with vehicles and stuff, and transportation. And I wish I could remember who it was, but this is my 3rd meeting, so I forget the other first one.
Thank you.
But we are
Okay.
building partnerships.
Yeah, okay, thank you.
Commissioner Jackson, followed by Commissioner Powell.
First of all, Belinda, what was the name of that fund again?
Direct supportive services. The person
And-
has to be looking for work, have a job, have kids, they have to be a family, and they have to be on some kind of assistance.
Okay, and as far as OSA, working with OSA and Elaine at OSA, I have her name, she's been invaluable with cutting through the red tape with DHS and getting people's applications corrected or through or their funding started. So I wanted to say that I do know you do collaborate well with OSA.
Want to put that out there. And Dr. Dudley, you mentioned the emergency food allocation for a family of 4 decreasing back to 400 from 900.
If that was their allocation,
If it was at that
that was just an example, that
Okay.
because of COVID, they may have gotten an increase. And so as an example, I use that just as an example. So whatever their allocation was for that family of 4, whatever they met that requirement, what they got with the COVID dollars that came in is going to be cut.
And so you did say that was just,
That was just
ballpark
my
figure.
example.
Is there a grid or any type of chart that will come out from the state that will show us? Because, we've been kind of keeping pretty good tallies of how many people are gonna be affected in what ways.
How many people are being, I say, as far as
In
grid for
Oakland
income,
County?
I
Yeah, for
don't
Oakland
have,
County,
I
with
don't
the
have a
emergency
number.
food allocation.
Yeah, I don't have a number
He
of
said
how many
7,000
people it
in the
would
state.
actually affect. There is a grid you can look to see, policies on, it's obviously available online, and it does have a grid of what a person, this amount of income making, what they should, about what they should receive if they're a family of 1. I always like to use the example, if you're a single adult, a senior who's maybe on Social Security, and the maximum you got due to your Social Security was $23, they're getting $203 during the pandemic. It's a big cut for even seniors, so I'm worried about not only the families, but also our seniors. Going back down to that $23 with the amount of food, but we're lucky to buy enough for breakfast for a week.
And that's the way the calls would be
And
identified
that's
to us.
why
They'll
we're-
say,
it's
this
an
is what I
FYI.
was, and this is what I'm getting.
Yes.
And it's
you
not
know,
the state of
something for us to
Michigan, be
know.
clear about that,
Federal
it's the
dollars.
federal dollars that are coming into the state that were the COVID dollars and the PPE dollars, the COVID relief dollars. And we asked, well, can't the state pick it up? And they said that would be trillions of dollars that we don't have.
And it's gonna be important too for us to work with, one of the recommendations when we met with the state director was that we also begin to try to work with the local food banks because, they got drained a lot too during the pandemic. And now with the rising in food costs, and once these individuals, if they're determined not to be eligible and they lose the food assistance, whatever portion of it, how do we make that up in our county? And so, the community, we need to get together and wrap around with the food banks to make sure that there's gonna be food assistance available.
Thank you. Commissioner Howard?
I just wanted to make sure our staff knew to make sure they get the information from Ms. Belinda in regards to those programs and those offerings that they offer, and share it with the commissioners, please, so that we be knowledgeable about those programs as well, and we can figure out and put them in constituents in touch to get the assistance.
Thank you.
Thank you.
And their application is online for
Okay,
Medicaid services.
And it says what the requirements are online as well.
okay.
Well, thank you very much. It was a pleasure to hear all the aspects of caring and services that you offer, that we offer, and how we work together.
And we appreciate being able to present before you so that you are aware of what's going on in the county and that we have been chosen by you to represent Oakland County. And so the other thing that MCSSA, I am the chair of MCSSA for the state, and Sharon is over the legislative committee, and Sharia is our representative for our advisory committee. So we do have a lot of input and say, and we have access to the people that are making decisions at the state. And I think as Belinda shared with you, we have been talking directly to the state directors about what's coming. And that's why what we're sharing with you is just an FYI. It is not the official information, but just beware.
Thank you.
Well, thank you for your service. You
You are
Thank you.
really
We're very
appreciate it.
fortunate, So good job, because I feel very blessed that we have a great board and we're always in attendance, and I think we always show up for every conference they have. And again, if you have any issues, feel free to email me, and I always follow up to make sure those things are resolved.
Thank you.
Because
Thank you.
customer service is number one, and I care about the clients, so.
Thank you.
Thank you.
Thank you.
All right.
Well, we made good choices.
We appreciate it.
Yeah.
Are there any,
Yes,
do you
yes,
want to
yes.
keep these for any other
Yeah, I think so. But I'd be happy to pass it on.
Dr.
So
Dudley,
I need a
go ahead.
motion to receive and file the information from today. Who would like to make that motion? I have a motion by Commissioner Kowalski.
We got a
support
slew
from Commissioner Jackson.
of them.
All in favor, say aye.
Aye.
Opposed? All
Our
right,
staff
we have
has that
received and
information.
filed
I can send it to you.
information. Thank you. We move on to.
Yeah, remember, I did a whole
communications. There are 4 items.
mental health.
Ladies.
Oh,
We're
sorry.
on communications. I know you're communicating, but we're in communication. So, there are 4 items under communications. The first is the animal intake disposition report from November. The second is the final and one-year report for our Oakland Together Mental Health and Wellbeing Nonprofit Grant report, which included 41 organizations and almost $8 million in helping others. The third item is the 2023 medical marijuana oversight grant application that we explored before, and so moving forward in a more efficient process. The last item is from the Haven, the quarterly report, October through December 2022. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? All right, communications is carried. We move forward to our Sheriff's Office recommendations. There are 5 items. 3 are amendments to service agreements with the Highland Township, Oakland Township, Lyon Township. We have a donation of 2 support dogs named Hope and Zotter. I've never heard of Zotter before, so that another interesting name. And the last item is from the second allocation from the Community Foundation for Southeast Michigan for the Innovation Initiative Grant. Would like to make, I have a motion by Commissioner Nelson, support from Commissioner Gershenson. Beyond our undersheriff and Guy here will talk about the items. Thank you.
Morning.
Good morning. Happy
Morning.
New Year. So are we doing each one individually, or are we doing them as a group again? The way we did at the,
Well, you're gonna talk about each item individually.
Okay.
And then we'll hopefully vote as a group, but we'll see how we manage it.
okay. All right, so the first one is for the Charter Township of Highland. They have requested an additional Deputy 2 position. That brings them to a total of 15 Deputy 2s and a total of 20 overall positions. And the amendment will be effective after full board approval near the end of January.
Thank you. All right, the next item with Oakland Township.
Okay, Oakland has requested to add 1 detective sergeant position. This brings them to a total of 2 sergeants. One is a patrol sergeant, and then this one is the detective sergeant that will oversee the detective bureau, which brings them to a total of 18 positions. And this amendment will also be effective after the full board approves it at the end of January.
Thank you. All right, how about Lyon Township?
Okay, Lyon has requested to add 2 positions. One is a Deputy 2 patrol, and the other one is a patrol investigator assigned to the Detective Bureau. That brings them to a total of 25 contracted positions, and this amendment will also be effective after full board approval at the end of January.
Thank you. And regarding accepting our 2 support canine dogs,
Okay, so we have two more puppies, and they've been donated through Mission Oakland. One is going to be assigned, Hope will be assigned to the school resource officer in Rochester Hills, and Zotter is going to be assigned to a dispatcher in our emergency communications division.
but how will Zotter be of value to a dispatcher? Because what I picture a dispatcher is in an office answering the phone.
Yes.
How will Zotter help that?
So it's more of an internal support. We've gotten a lot of requests
okay.
because obviously
All right.
they take, they have a lot of traumatic calls that they take and a lot of traumatic situations that they deal with. So
I agree.
it's kind of our first attempt at an internal after we had a lot of,
Very nice.
a lot of
I like
requests
it.
for it, so, yeah. Because people will stop in that are working, that have the therapy dogs, have stopped in there, and obviously there's an overwhelming acceptance and thought that that might be a good idea.
Yep, thank you.
And then obviously they have, they're 24/7, they have 3 shifts, so I think they're gonna try to figure that out, but definitely to help internally.
Thank you. And then the last item references the Innovation Initiative Grant.
Yeah, so this is our second allocation. If you recall, last year, we had the first allocation from the Community Foundation of Southeast Michigan that gave us money for equipment for the driving simulator and the trailer. This portion is to fund overtime to continue our community education series.
Thank you. Any questions about each of these items? Commissioner Cavell?
Guess I should be tighter. For the amendments for the law enforcement services, these come to us, just to remind me if you don't mind, these come to us from like the request of Highland Township saying what we would like is another, okay, understood.
Absolutely.
Thanks. And then with the Community Policing Innovations Grant, this, just to remind everyone, and tell me if I get it wrong, Gabe, this is $1 million that came from Oakland County Executive Office budget recommendation a year or two ago to the Community Foundation. And then it's been in a pot of money. And then we have been getting that money from the Community Foundation from our tax roll budget to do things like community policing innovations, right?
Technically, yeah, it was
Okay.
open to the whole
Sure.
county. And then I think there wasn't an overwhelming response that they kind of expected. And that's when Barb Hankey reached out to us and said, hey, you know what, we know that you're doing this community, she had attended one of the community education policing series and said, hey, you know, we really think this could be of value. We work with these national technical assistants, and that's how we got involved in it.
Okay. So what concerns me about this is if we're just going to give you more money in your budget, let's just give you more money in your budget going forward, because it looks like we've used up the $1 million pot with this allocation. And then second, we're using this last tranche for overtime, which last year that was a big problem. So is there something more structural here that we need to be looking at instead of like this pass-through thing? I don't know if you have that answer or something, a bigger talk, but.
I mean, that's probably a bigger conversation, but this is
Okay.
specifically because we couldn't teach this with our current staffing. And so they're funding overtime, and obviously it's one lieutenant, you know Lieutenant Workman teaches it, so it's basically paying for his services outside of,
Sure.
outside of the scope, that's what the grant's
Yeah.
paying for, so.
So he's gonna make $164,000?
No.
So,
He's,
okay.
well, he's
Isn't that what he makes as like a
but there's-
lieutenant? Yeah.
But there's,
Or 109
obviously
or
there's
something?
supplies and there was whatever, so,
Okay.
and then, obviously,
Okay.
we worked it out with the,
Other stuff, gotcha,
with
okay.
the technical assistants and everybody worked out
Gotcha.
that that's our allocation and how it's going to be spent
Cool.
for the program.
Okay, but just want to lift up, I guess, for us, when we think about budgets coming through, in the future, I understand now from your context, thank you for that the idea was there'd be greater uptake, but because there wasn't, this just ended up being a, like, executive budget pass through the Community Foundation to the Sheriff's Office, so we can kind of erase the Community Foundation and probably their 5 or 10% admin fee from that, so we can put the $1 million in the sheriff's budget if that's what we want for community policing. Because right now your whole training budget's $2.7 million. So this is like, making your training budget a third bigger.
Well, it's enhancing what we've already done. So,
Yeah.
it's above and beyond what we would normally do. So that's a bigger conversation. If that's
Okay.
what you wanted to fund, then, and put that in our budget, then we would address it that way. But
Okay,
this is above and beyond what we were normally doing.
thanks.
Mhm.
Yeah.
Any other questions? Okay, so this is acceptance of a grant, and you've advised us how we're spending the money. So Commissioner Cavell is saying, let's look at the bigger picture so we don't spend so much money on overtime. Okay. Anything else? All right, the vote on the Sheriff's Office recommendations.
Jackson?
Yes.
7 yeas, 0 nays. All right, motion carries. Thank you.
Thank you.
Our next 4 items are from the Health and Human Services Department. The first is Great Lakes and Energy for our public water programs. Second is Oakland Livingston Human Service Agency, Women, Infants, and it's the WIC services. The third item is regarding positions, and the fourth is an extension of the Legal Aid Association and Mediation and Legal Aid Eviction Prevention Programs. So, welcome.
Thank you. So I'm wondering if I could take the, go
I
ahead.
need a motion first. So I have a motion by Commissioner Powell, support from Commissioner Joliet. Thank you.
Quick request, if I could take the first 2, and then Shane is on the phone, and he's going to take the second 2 items. So I don't know if you want to ask questions after the first 2, whatever you want to do, that's
We'll do
great.
that.
Okay, perfect.
Thank you.
So the first request is our Eagle contract, which is really around our water resources, right, our staffing. So this is really focused on our non-community water supply. So just as a reminder, what that is any community supply, right? Somebody that has a building, like say the one we're in and they're on a well, and they serve at least 25 people a day. They're required to submit certain water samples on annual basis, 6 months, lead and copper, nitrates, to make sure, even bacteriological, to make sure the well that's serving all of those clients is safe. They do lead and copper. It might be every 6 months, might be every year. They do metal sampling every 6 years. So it's just to make sure that those wells that are in place are protected and continuing, and those people that are in those buildings are receiving safe water. Drinking water, long-term monitoring. Just a reminder what that is. When we know there's an area of contamination, maybe there's been a gas station that maybe has leaking gas tanks, we monitor the groundwater. So the state hires us to go out and take those samples. Very specific ways to take samples. That's why it's important that those individuals that are trained. So each year we're contracted to do certain sampling. Campgrounds, we go out and we do annual campground inspections. A lot of people don't know that exists, but we go out annually and we check the campgrounds that are licensed and offer recommendations. If there's hazards in the campgrounds, we look at well and septic as well, just to make sure as people are coming out annually that those are being monitored. Public swimming pools, same thing. We do public swimming pools. At least once a year, every public swimming pool gets an inspection, and so our staff are trained to do that. And then septic, those are just septic haulers. You'll sometimes see them here on campus that are working on septic tanks, or taking the hauling septic from the septic tanks that are around the county. So we actually inspect those as well. So the funding is generally, it'll go up and down, really depends on the number of units we might have, right? Public swimming pools might go up and down. Same thing with non-community water supplies. Depending as our county grows, right? People might put a building and put a well in because there isn't city water available, so we might add some. People go on city water, so it does fluctuate. So this, we did get an increase of state funding for $261,000. This is great for us. A lot of times, we're using more general fund than we are, receiving from Eagle, so they're really trying to make that more equal, and so that's why you see this increase.
Thank you.
So the next one is our subrecipient for OLSA. So OLSA helps us deliver WIC services in Oakland County. They're actually the only agency that does this. So obviously we pay them a portion to offer those services. So for this is actually 3 quarters worth, so 9 months of funding that goes to OLSA to help us deliver those services. They have actually 5 clinic locations that they operate in Oakland County, which is great because it allows us to spread those services out. Access to the service is much easier. And so we, like I said, share the funding with them, and so this is for their portion for this year to offer those services.
Thank you. Are there any questions about these 2 items? Commissioner Gershenson?
Where are the facilities?
Actually, I can provide those to you. So Farmington Hills, they operate, it's CARES in Farmington Hills. Carl Richter Center in Holly. Madison Heights, they have a location. Obviously, the OLSA building in Pontiac, right downtown, they offer. And Journey Lutheran Church in Oxford. So again, trying to spread and provide better access for people. We've also, due to COVID, there's a lot of opportunity for virtual meetings, which has been very favorable for people that can't get in. And so we feel at some point, when they move back to in-person 100%, there will still be opportunity for virtual sessions, which has worked out very well. The other thing is I think this is a perfect intersection to MDHHS and the presentation they just gave. We have seen a significant reduction in WIC requests because there's been a lot of opportunity for people with food service or, federal funding for foods, but we're starting to see people come back to WIC, and so, which is a good thing, right? And we're really looking for opportunities to connect with people that maybe were like, it's really hard for me to do that. I can't come into the office every 6 weeks or whatever it was. So connecting with people, letting them know we have these virtual services now, we're starting to see that increase again, and expect come March, right, we're going to see another big increase in the number of clients that we'll see. And so we're prepared for that and really focusing on what we can do to make sure we see everybody in a timely manner. And I did connect with them, so we have a lot of opportunities that we're going to work with over the next couple months.
Thank you. Commissioner Joliet?
Hi, thank you. Quick question in regards to WIC, when you said that you're seeing more of an influx of people coming in now, were they not eligible when they were receiving? Okay.
No, I think the issue was it was easier to receive some of the COVID benefits, right? There wasn't a lot of paperwork. Everybody was kind of receiving what they were requesting. And so, there's a lot of requirements to WIC, right? Like you have to be recertified very, so frequently. And so it was just easier to say, okay, for right now, I'm not going to worry about that, right?
But they could have.
They could have.
They could have. That's what I was trying to understand. They
Yes.
could have had access to that.
Correct.
They just chose not to. Okay.
Correct, yes.
Thank you.
Any other questions about these two items? Okay, then we move on to the next two. Neighborhood and housing development, staffing modification, deletion, and creation of positions. So we did establish the Housing Trust Fund with 2 part-time positions, and this is a request to delete those 2 part-time and create 2 full-time positions. Shane, what would you like to add about this item?
The only thing I'd like to add is that we've had this posted since approximately July. We didn't get the numbers of applicants that we were expecting to have received, and so after some conversation with those who have not applied, who might be interested in applying, is that there are a lot of people that were looking and might have applied if it was a full-time position, and upon further review of the amount of work that would be involved and also a review of the job description to allow for some additional items of work, we felt that it's most appropriate to upgrade both to a full-time position. And the way that the original miscellaneous resolution was written and the amount of administrative funds that could be used to cover these positions, we don't have to increase funding to create these full-time positions. So this is simply just permission to turn them from part-time to full-time eligible positions.
Thank you. Do you know how many people or units or housing took advantage of this since its inception?
Are you asking the number of applicants we received for those positions?
Thank you, that was simpler.
We received 15 applications for the manager and 33 applications for the coordinator. And after reviewing the job experiences, we interviewed about 7 for the manager position, and none were candidates that we thought were a good fit after an interview. So we're wanting to expand the pool of potential applicants.
Okay, so it's still January, so it's my miscommunication. For people who, do you have an estimate of how many people applied to use the program?
So the Housing Trust Fund is set up to provide gap financing for housing developers. And we haven't been able to stand up the program to say, here is some funding available to developers to create or rehab affordable housing units right now. So we haven't put out any funding opportunities because of not having the manager or coordinator in place yet to get the Housing Trust Fund Board established, get the rules and regulations put up, and also get the funding notices put out and start seeking applications. We haven't had that opportunity to do that yet.
Thank you. Commissioner Joliet?
Hi, thank you. A quick question. What is the difference in cost between deleting the 2 part-time positions and adding the full-time positions? I see the detail of what the cost is for the full-time position, but what's the difference that's being incurred?
Off the top of my head, I don't have that exact difference in front of me, but just knowing what grade they were and the normal budgeting process for PT&E versus an FTE with like, 35% fringes on average for an FTE is what you calculate in. There's approximately a difference of about maybe $120,000 additional funding that will be used to support salaries and fringes of these 2 employees as opposed to the part-time. But again, the way the original miscellaneous resolution was written, it allows for up to a certain amount of money from that annual general fund allocation to be used for administrative costs. So this would be just about $110,000 extra to be used for salaries and fringes of these employees as opposed to, other potential administrative items.
So then the extra roughly 120K is coming from the general allocation. It's not neutral, or is there an increase that you would need from the general allocation to fund this?
We're not asking for additional funding. So the way the miscellaneous resolution was written was that it would allow for up to $500,000 of administrative funds to be used for administrative purposes such as salaries and fringes or printing or building space for the employee's office should we need that. And there's a little bit of future proofing in there. So imagine a scenario where maybe for the first 2 or 3, 4 or 5, however many years, we only needed to use $250,000, $300,000 in administrative costs. Well, that remaining amount could be put towards a little bit extra in another notice of funding availability for affordable housing developers. So yes, we're not asking for any additional funding. It's just that instead of maybe some of that additional $100,000 going towards another notice of funding availability for gap financing for affordable housing developer, we're just wanting to use that for salaries and fringes of the full-time employees so we can help get it off the ground and get staff involved and get it stood up.
All right, I understand. Thank you.
Okay. Any other questions regarding this item? All right, the last item under Health and Human Services is an extension with our legal aid and eviction and foreclosure prevention program. What would you like to tell us about this one, Shane?
I have just a very small number of slides. If I could be given permission to share my screen, that's why I'm presenting virtually. I figured it'd be easier to do that than try to figure out thumb drives, email and presentation, all that kind of stuff. There we go. Thank you. All right. All right. So as a brief reminder, about a year and a half or so ago, or maybe a little over a year ago, the Board of Commissioners approved state and local revenue ARPA funding, $2 million in total to support 3 nonprofits, Oakland Mediation Center, Lakeshore Legal Aid, and Legal Aid Defenders Association of Detroit, to provide eviction and foreclosure free legal representation to Oakland County residents who have received an eviction notice or are going through the foreclosure process to work with them through that process. And part of the miscellaneous resolution, we had to come back to the Board of Commissioners to ask for approval to renew the contracts. This is just more detail on the agencies, their websites, and their contact information, and this should be provided in the communication and in the official record. This is a excerpt from the flyer that we sent around to any number of listers, commissioners, et cetera. Please feel free to use this information in any kind of communication you have with constituents. We definitely want to make sure that this information gets sent around. So some detailed summary beyond the regular quarterly information that is should be getting over to you with like the number of assistants. Just wanted to share some brief extra detailed information, just know kind of how things are going with the program. So we've expended over about a little more than 50% of the $2 million. Please note that this doesn't mean that if you're to ask fiscal for a report that would show this much expended, because invoices, we might not receive a reimbursement request for expenses through December end of 2022 until mid-January or end of January. Then it takes a little bit of time for that invoice to get processed, reimbursed, and then show up on fiscal services. However, when communicating with the three nonprofits, this is the total amount that they will be in full asking for reimbursement through the end of December 2022 for those activities that they've partaken in. Unfortunately, given the number of calls that they're receiving, the eviction filings with the courts, and just the average reimbursement requests that they've been asking for, it's unlikely that this service, as currently funded, will last through the summer at current funding levels, maybe end a little sooner than that. That's in part because the courts are seeing an increase in eviction filings. It's partly due to backlog processing at some of the district courts, but it is also in part because there are new eviction notices being received. In fact, one local district court has increased the number of landlord-tenant dockets from 3 to 9. They've permanently increased staffers and increased the number of judges focusing on just evictions from 1 to 2. Below is the total number of households and individuals in those households that have been assisted so far through the end of December of 2022. The program, although some of the contracts got signed in February of 2022, they really didn't get up and rolling until closer to March or April. This is just a quick bar graph that shows the number of households that have been assisted by the agencies. This is not, and I do want to emphasize, this is not the number of eviction filings with the individual courts. Not all individuals who have had an eviction filed against them accepted or were able to get in contact with the nonprofit to get assistance, and that's not through fault of the nonprofits. Just oftentimes, that's not the assistance that somebody is looking for, or they're not able to otherwise coordinate with the nonprofits. When we started to get more detailed data collection beyond just the raw numbers of households and people assisted, this is some of the metrics and the details that the agencies were able to share with us. So all the households, they have goals. Sometimes they have more than one goals, but 80% of all the households assisted had all their goals met. And most of them had a goal of preventing an eviction or preventing an involuntary move. Sometimes that they will coordinate and they want to secure additional rent assistance through other programs that this program doesn't provide for. This program just provides for legal representation. And another goal is often sometimes, hey, I know I can no longer afford this particular apartment, but I would like to negotiate more time to pay my back rent so I can move out and so I don't have to have an eviction on my record. Some additional demographics of the household. 66% of the clients were currently employed. Many of the others who were not employed were on fixed incomes, such as Social Security. 25% of the household had at least one adult living in that household with a disability. 40% of the clients who were being assisted with eviction had at least one child in the household. And of those households that had a child in their household, 15% of them had at least one child with a disability. So this program really is assisting households that have some very legitimate financial pressures and other things that they are trying to navigate as a family. So those are some of the numbers. Here's just a few examples that kind of represent those numbers. There was one family that was to vacate their property on Christmas Day. It might seem minor, but one of the legal counsels were able to coordinate with the landlord and their counsel an additional payment plan so that they could at least stay within that property and within their home, at least through the holidays. This was significant because this was a household with children. The next one I want to share is that we received the nonprofits received a referral from youth assistance from one of the local youth assistance offices. And this goes to show and highlight the importance of getting the word around that one program knows of another program's existence and they connect those eligible residents with them for that assistance. This is a household who had a mother who had just received a new job as a forklift operator at GM. Due to the recent unemployment, they were 2 months behind on the rent. The council for the nonprofits were able to negotiate additional time to pay back the rent. So the eviction filing could have a conditional dismissal and they didn't have to have an involuntary move. Another example was that a tentative, that the landlord and the tenant had conditionally agreed to an approved payment plan and a conditional dismissal of the eviction notice and filing. But on the final day of the hearing, the client logged into the wrong Zoom link. And as a result, the judge entered in a judgment of eviction, leaving her to have to vacate in 10 days. Well, the counsel for the nonprofit was able to coordinate with the counsel for the landlord. They renegotiated the payment plan, the conditional dismissal, and they were able to facilitate getting it set aside, getting the eviction judgment set aside, so that didn't have to be on the client's record. And that last one I do want to highlight is it's not always adversarial, I'll say, but this was an example where the landlord was, hey, listen, this is a process we're going through. I understand that, but they were willing to work with the tenant. They just needed that additional assistance with the nonprofit counsel who had the knowledge and ability to, coordinate that from one counsel to another. And with that, I'm done sharing my information, and we're just asking for permission right now to reapprove those contracts for at least another year or until funding runs out. And with that, I will stop sharing my screen.
Commissioner Powell, followed by Commissioner
I just want to encourage my colleagues to really, really, really be in tune with this ask. The reason I'm saying that is because 50th District Court was backlogged about 6 months. She just put a lot of stuff in place. And every Friday, I think she started last Friday, she's putting 80 evictions on the docket. So every Friday at 50th District Court, that's almost up to 80 people or 80 families that can be on eviction. So however legal aid or these services can help these families, it is needed, and I'm just letting y'all know at least about one courthouse that we do know was backlogged tremendously. And a lot of it, just so everybody know, is she had a decline in staff. She didn't have clerks for months. So she's just finally up to all the clerks. I think she needed 9. I think she's at 7 now filled, and she's confident. And we just got a new judge appointed there also, because that was lacking. We was down to 2 judges. So just to let you all know, I pray that you all have it in your heart to extend, and even if they come back to us asking for more funding, be it if we have it, please, we got to help in this space. Thank you.
Commissioner Bell?
I just want to lift up again what Shane said about the number of evictions, 4,400 households in the last 11 months. And again, like I think all of us have been saying, we are cresting this wave. Well, now it's the new year. And like Commissioner Powell said and Shane said, now people are staffing up to go through this faster. So this is going to get a lot worse. A couple questions. Or I guess one clarification just to make sure, so please tell me where I get something wrong, Leanne and Shane, which is, from what I understand, even if you start going through an eviction process, whether it's been cleared or not, a landlord can then see the fact that some piece of paper was filed with the court related to eviction, even if you weren't evicted, for up to 7 years or something, so it can then prevent you from getting access to housing in the future. Is that right?
Yes, that is correct.
So it's not only if you get evicted, like these 7,600 individuals in Oakland County can no longer find housing, because why would a landlord ever want to house these people if they can find someone who doesn't have an eviction on their record? It's the 15,000 families that have just had to go through the courts or even get eviction avoided, or like Shane lifted up the stories that say, you know, I needed some help with back pay, but I needed a legal aid to help me. Those people now also have just as likely a chance of not being able to find housing in the future. And that's in every zip code in the county. Okay, so just want to make sure I got that right, because I heard that from somewhere. So then the second thing you mentioned, Shane, was that this funding should run through the end of the year or until it's done. Has there been any talks about, because this is ARPA, have there been any talks about fully funding this through the end of ARPA, or at least the next couple years, or is there any way we should put behind, or consciousness we should raise about, you know, this is $1 million a year. We have $80 million in ARPA.
Right now, the agreement is for $2 million between the 3 nonprofit agencies. I think those are good conversations to be had between the Board of Commissioners and the executive leadership team on how to best prioritize the remaining state and local revenue funding ARPA sources. I know that if there were to be more funding that were to come to these nonprofits, they would definitely be able to utilize it, and they would continue to utilize the program for these purposes until funds are remaining. If that is shorter, in 6 months or so, or maybe 9 months, they'll do it for 6 to 9 months. If they were to get more funding, they could very likely continue the program after that. That's, I think, a worthy conversation worth having.
Okay, thank you.
Commissioner Nelson?
Thank you, Madam Chair. Shane, I appreciate the legal eviction and foreclosure prevention document attached. With that being said, if a community is not listed, who should I direct them to? Because I noticed that on the legal aid and eviction foreclosure prevention document, there's 3 different Oakland Mediation, Lakeshore Legal, and then Legal Aid Defender. If a CVT is not listed under one of those 3, how should I proceed in helping that specific resident?
So if for some reason there was an oversight and there was a particular city, village, or township that wasn't listed, it simply goes by the district court that the eviction filing was located in. Now, with these three nonprofits, this isn't always the case, and so I do want to lift this up, but these three particular nonprofits work extremely well together. So if one individual reaches out to one of the nonprofits simply because it was the first number that a resident dialed, they simply get them in touch with the correct agency. Now, as far as a correction or an update of a particular flyer, you would just have to let me know, and I could make sure that our health education and graphic designers updated the flyer accordingly to include the missing city, village, or township.
Excellent. I appreciate that clarification. Thank you.
All right, any other questions? All right, so then would you prompt the vote on the Eagle Water, thank you. Yes, summed it up very nicely.
I didn't ask the thing. Can I ask one more question about stuff?
Are you voting first?
Yes, already
Or
voted.
voting? Did you vote?
Yep.
You already voted?
Yep, already
Okay.
voted.
But when the outcome comes, so don't go away, because Commissioner Cavell will have one more question in just a moment.
We have no official,
Okay, you have 6 yeas, 0 nays.
All right, that motion is carried. Thank you. Commissioner Cavell?
Thanks. Leanne, we heard from the
MDHHS.
Thank you. Yep, you already know. So they said food. Everything's gonna go to crap with the food. We gave you $2.5 million of ARPA to do like a food systems analysis a couple months ago. Can you give us a quick 30-second update on how that's looking?
Yes, so I can let you know, Oakland Hope was provided their $500,000 to start providing more food. That was done January 4th. Lighthouse was given $300,000 to continue their food assistance. Pontiac Foundation is finished their contracts at the end of November for $350,000. I would have to bring back a report for who they funded. I do not have that with me, wasn't prepared to talk about that, but we can definitely get that and get that out to you. So then we have 2 additional projects, right? Double Up Food Bucks. We had to put on the back burner for a little while. There were some issues with the program at the state and federal level, but we just started negotiating back with them, so we'll be able to provide a better update the next meeting. The landscape project. So if you remember, that's to really look at the food systems in Oakland County. We just started with the negotiations and looking at creating an RFP so we can look at who's going to initiate that project. So we will be, in the next couple months, finalizing that and really starting to get a look of what the food landscape looks like in the county. So we expect, right, that we're going to probably hit about the time that that information comes out that that food assistance is ending. Again, I was a little surprised that hearing that same SOS from them that was coming. So I actually got on the phone right away and said, all right, we need to start talking about this as HHS, what we're going to do, right? So I'm hoping to engage like Carrie and Melanie and obviously the executive team to say, okay, what are we going to do moving forward for this? So again, I know WIC will really be impacted. I want to get with OLSA, right? What are they hearing? What kind of challenges are they having? So I'm hoping that we'll do our own, right, at the local level, not wait necessarily for the state to say this is what's going to happen, so we can start moving forward with that information I received today. So, yeah.
Thank you.
Thank you. Thank you. Our last agenda item is from Emergency Management and Homeland Security, a recommendation regarding an Oakland County Fire Mutual Aid Association and the City of Troy to create a countywide incident management team, which includes a donation from Troy regarding a command vehicle and a pickup truck. So Commissioner Nelson has the motion, Commissioner Powell has the support. So thank you.
Good
What
afternoon.
else can you add?
Good afternoon, Commissioners. Tom Hardesty on behalf of Emergency Management. A lot of moving pieces here, so I will try to be clear and concise with this. So the Oakland County Incident Management Team has been in existence since the mid-2000s. Incident management teams help manage large-scale disasters or emergencies. Commonly across the country, you will see them involved in wildfires, hurricanes. More recently in Michigan, and the Oakland County team was of assistance during COVID. They were for us with the distribution of PPE as well as emergency medical response that was overwhelming some of our communities, particularly in the South End. They assisted in Detroit with vaccination plans, with the hospital set up, with the Midland Dam break. So this team in Oakland County has been run by MABUS 3201. There are two main fire mutual aid organizations in Oakland County, commonly referred to as the Rural Organization, which is 3201, and the more Urban Association, which is 3202. The Oakland County IMT has been financially and mostly management supported by the one group, by 3201. A couple of years ago, they came forward and requested that we look at Oakland County taking that over. We actually had some grant funding and brought in IMT consultants to meet with both us, with 3201 reps, with 3202 reps, with city managers, and they came back with a recommendation that they did think it fit best with Oakland County. So with that, we brought that to administration, and then as part of the budget process for fiscal year 2022, included up to $35,000, which is mostly for maintenance of that equipment that you see in this attached agreement. Most of the equipment purchases that is right now owned by MABUS 3201 and Troy was actually done through grant fundings that come through our office, and then it's been used for that. We have a couple of members of the leadership team here, Chief Cieslik and Chief Wheel. So it is important to note that incident management teams, they're not people that's like their job. These are representatives heavily from cities, villages, and townships, but not exclusively, who have extra training and expertise that they bring together to help manage those scenes. So we're not, these agreements are so that we would have them with the cities, because many times you're using their staff to come together, and then possibly with individuals who are not working for a city. And I'll give one example, Holly Conforti, who many of you would know as a finance person here for the county for many years, was a member to help with some of that finance piece. We would still like to use her as part of the incident management team. She wants to volunteer her time, so an agreement to be able to use those people as volunteers as well.
Thank you. So both chiefs have been here through our meeting and part of the last meeting. So because you have so patiently sat through here, would you come up and introduce yourselves?
Way to go, Penny.
Yeah.
And Chief Quapis was actually, had originally planned to be here as well. He's been the president of 3201 for the last number of years. Unfortunately, he's ill today. So.
Thank you for inviting us up and considering this proposal. My name is John Cieslik. I'm from the city of Rochester. I'm the fire chief. I currently am the coordinator, or one of the coordinators, for what we still call the Oakland County Incident Management Team, because we work so closely with Tom and his team to handle emergencies within Oakland County.
Thank you.
Good afternoon. Matt Weil. I'm the assistant fire chief with the North Oakland County Fire Authority, and I'm housed up in the northern portion of the county, two townships we cover.
Which two?
Holly and Rose, excluding the village of Holly. So what I bring to the table, I'm part of the incident management team as well. I'm on the communications support platform of that, and since Chief Nelson started this program back in the early 2000s, I've been involved in it. And really this does seem like the next logical step in progression for this team. It needs a home that is central and unified versus two separate organizations trying to run it. So again, this is something that we have been working on for quite some time, and your support is paramount to make this happen.
If I could just add one more thing, Tom talked about what we have done from an emergency standpoint, but with his guidance and counseling and his staff, we are now making plans as we look at large events. You know, as firefighters and emergency responders, we'd much rather plan and be ready and prevent things. So we're now doing what we call incident action plans to get prepared should something happen. And we really don't want to ever use those plans, but we don't want to be behind the curve and making sure that we have things ready to go. So not only do we look at responding or helping to manage large incidents or events, we are now also, for Oakland County, pre-planning events such as the last large one was the City of Rochester Christmas Parade, in which we had a large incident management team there ready to go. We had plans in place should something happen, and we're working with other communities to make sure that Oakland County and the events that we do here are safe for all of our residents.
Thank you. Commissioner Cavell?
Yeah, I see I understand the context of this from what you've lifted up here and what you both have been saying. But one thing that might be kind of a curveball question, so forgive me, but right now in Royal Oak Township, the water pressure is so poor because they need a new water main, and like they have lead pipes and stuff that's 100 years old, that they would not be able to put out a fire if there was a fire in Royal Oak Township. And I know a few years ago there was a fire in Detroit where a similar thing happened and 85 houses burnt down. So is this one of those things that counts for incident management team as well as like the Woodward Dream Cruise and Rochester stuff?
So if there were an incident there that got beyond the capability, so if there were a large fire, and initially you would have whatever agency is handling it, they might reach out for mutual aid. Then it gets beyond that. So an incident management team, we look at it, it's beneficial to us in the EOC. We're trying to help manage resources. The incident management team is, and we're trying to get them to the scene commander. Well, when scenes get really big, it gets difficult for that incident commander to keep track and manage all of that. So the incident management team is there on the ground being support to that incident commander. So now we have better communication, clear requests for resources, which means we can fill those resources quicker. So the fact that they don't have good water pressure, would the incident management team be involved? No. What could result from that? Yes, the incident management team could
Understood.
assist with that.
Yep, thank you.
All right, any other questions? Commissioner Powell?
So Woodward Dream Cruise is an event that y'all kind of prepare for, correct?
Yes, they've
Okay.
actually been involved in Woodward Dream Cruise with the fireworks in
Okay.
Detroit. The incident management team
Okay.
has assisted them for a number of years, other large-scale events.
Okay. Just so you kind of, I knew they were though.
Good looking out, thanks.
I'm the point person.
All right, would you prompt the vote, please?
You have 6 yeas, 0 nays.
Thank you,
Motion carries.
Commissioners.
Thank you.
for your consideration.
Tom. Thank you, Chief.
Thank you.
Thanks for your patience. We move to our last public comment. Is there anyone from the public wishing to comment? Seeing none, public comment is closed, and I will adjourn this meeting at 12:42. Thanks, everybody.
Nice job, Madam Chair.